Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Hannah is our almost 11-month-old marmoset, has been favoring her left hand now for a couple of days, and don't know if she miscalculated a jump or what, but is in pain. I know. And then just wave a blanket after or something. Oh, there you go. You're a pro.
There you go. Don't do it. There's a breeder out in Florida that we got him from. We were supposed to go out there, but he met us halfway. So.
Oh, okay.
Medicine, Ohio. Yeah, we researched probably a good 3 years.
More than halfway for
Yeah.
We researched about 3 years to make sure they were, good for us. We were good for them, and that's why the only way we would have done it is if we could get two. And so because they're very social, and even the vet up in Madison was very happy we got two because they need each other to learn from each other. And
are they social with people too, or?
Absolutely. Okay, we're gonna do this real quick leg, baby girl. All right, sweetie pie.
You can hold up more towards the neck.
Probably can't.
Try that because she does play. There you go.
I don't think she can reach you, but yeah. Go ahead.
1, 2, 3, 4.
Oh, it's okay. There you go. Is this a sedation?
Yep. So we'll leave them in here for about 10-15 minutes.
So what we did is, because monkeys are a little bit difficult to deal with, and some of them will even carry TB, which is tuberculosis, we got to make sure that before they come in here, we make sure that they've been tested for TB. And this monkey was tested at the university up at UW in Madison. So we agreed to look at him just because Madison wasn't available to check out the monkey at this point. It's Friday afternoon and nobody else in town will see them. So he's got a very swollen leg on the left limb, if you see the difference between these two limbs. Oh, very, very swollen here. So we told them that we would see him and we would have to sedate him first. So we used a drug called Elfaxone, which is a very safe drug that we use in exotic medicine, and it causes them to sleep very nicely so that we can get a radiograph. So we're going to get him on the x-ray table and take a radiograph. I don't see any fractures or anything, so I wonder what their vitamin C. I have to look and see what their nutrition status is. So you can see here the comparison of the two legs. This is the radius and the ulna bone. So radius and ulna, this is that part of your arm if it's a human. And then all this is very swollen muscles and soft tissue. A lot of these guys are poor calcium diets and don't get vitamin D. They're not taken outside. The winter is here, so they're not outside in the sun at all, and we'll find out what his diet is. That's going to be very important.
Something? Looks like a little something.
He's thin and, how old is he?
11 months.
Oh, he's a baby, huh? Yeah, just because he's a baby, I bet you any amount of money he's on a poor diet. They have a high requirement for vitamin D, so if they don't get out in the sunlight, you've got to provide them with UV light, which provides vitamin D during the winter time. Then they need marmoset food, which is special food made for them. And then in addition to that, about 15% of their diet should be fruits and vegetables. And they do need a vitamin C source, so the marmoset food, I'm sure, is going to provide that. If they don't get vitamin C, they're going to get scurvy, like in the old days, what the guys coming over on the ships got all the time. And guinea pigs get scurvy a lot of times because they have a high requirement for vitamin C. So what we're going to recommend is that they change the diet of this marmoset and then put them in a cage for 6 hours during the day with a UV light on it. And this is probably metabolic bone disease along with scurvy, and this is what it's causing the clinical signs in this marmoset. And it's a young one, so they can probably change up the diet. They maybe can make a slurry of the marmoset food along with his whatever else he likes to eat. He probably likes a lot of bananas and sweet things. So they can put the marmoset food in there, and then they can also add some crickets, gut-loaded crickets in there so he gets more calcium. They're feeding a lot of chicken, which these guys shouldn't be eating. That should not be their protein source. So I think we can make them better by, we're going to give them vitamin C injection, we're going to give them a vitamin D injection, and then change his diet up, and we can probably recheck him in about 2 to 3 weeks and talk to him about the diet and what they're doing.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, Premier Doggy Day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. HAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. HAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
The camps are set up as an educational tool to get the kids in here and do a little bit more intensive work with them so that they can learn about animal welfare, pet responsibility, animal safety. So the program's set up so that the kids do a variety of different things. And we try to make sure that the kids get both an educational experience but also have a lot of fun while they're here.
Hi, you guys. How are you? Are you excited to see everything here? Who wants to be a veterinarian or a veterinary technician? Wow, that's awesome. So I'm Dr. Marla. This is Dr. Michael. Say hello. Hey, guys. Hi. And Deb, of course. So what we're going to do today, first of all, this is my hospital. I own the hospital. And we're going to show you things that are going to be really interest you, especially if you want to go into this field. Because you know what it is? To be a veterinarian is like the best career ever. You know why? Because you have fun every single day. Just think, treating animals and taking care of animals every single day of your life. So it's the most fun job ever. This is Packer. Packer has 2 disabilities. Can anybody guess what they are?
He's missing a leg.
She. Yeah. Missing a leg. She's missing an eye. I got her from Maddock, which is the domestic control place, and she had been hit by a car 11 years ago, and she was dragging her leg, so I had to amputate it, and then she hurt her eye too, so we had to take her eye out. How many of you think that she does not like this? Huh? How do you think she gets along? She gets along pretty good, huh?
Yeah.
Like a normal dog, she doesn't even know that she's missing a leg or an eye. And all the other dogs don't even laugh at her. Can you believe that? So that's why it's really important to understand when somebody has a disability that it's okay, right?
Yes.
So she's a mascot at the hospital, and she runs all over the hospital and talks to people that are putting their animals to sleep or are sad about their animals being brought into the hospital because they're sick. So she helps all the people. I'm going to show you her trick. Sit up. Sit. Sit. Smile. 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 Sit. Come here. Sit. You know, I've always wanted to work, and I have for years and years, work with the police officers. Because I have a strong heart and belief for the police officers because of the fact that they work day in and day out and they have a bad rep. At the same time, they do so much good for our world. The guys, and then one step further, the guys with the police dogs are incredible. So I was training them in CPR at that time, so I would give them CPR in case their dogs got in trouble when they were out in the field with them. How could they take care of them? Then I started learning, oh my goodness, these guys, these dogs are like their partners. They're exactly their partners. They have their backs. They go out in the field. They're the first ones shot and the first ones stabbed out in the field. They can lose their partner any second of the day, and these dogs have their backs. And then what they do is I started learning that they'll go in, and the dogs, they have no sense. Like a police officer's always thinking. You always have your mind. You know, okay, well, if I go in there, then I might get shot, or there's something going on, I hear something. The dogs are like, poof, in, and they're going, and they're going to complete their task, and there's nothing else in their mind at all, except for the Kong toy that they get at the end when they complete their task. And if they die doing it, so be it. That's not in their mind at all. And I realize that, you know, when we have that salon that where that person got murdered, or that Sikh temple that was busted into, the dogs were right there at both of those instances. And all over the world, dogs are being used, service dogs are being used, and I realized how important these dogs are to us. So Deb Lopez and I set up this foundation, and it's for, initially was for vesting every police dog in the Wisconsin area. So getting a vest on them, so when they go out in the field and they're shot at or stabbed at least they have protection, just like the police officers do, their partner does. And then we realized, oh my goodness, these police dogs are even more important because they come into our country. Usually they are adopted from a foreign country like Hungary or Germany, or some of the dogs that come from those countries brought over here, and then they're trained, and then they work with their officer for 6 weeks in training, and then they need veterinary care from that time on. They need a special car to keep these dogs and drive with them, so that when the air conditioning never goes out when they're in the car waiting while the police officer goes inside to investigate something. So they need special cars. And their veterinary care, these dogs require $20,000 or $15,000 just to acquire them, and then at least $25,000 to keep them going until they're 9 years of age when they retire. So from 2 to 9 years, then after they're retired, they need a new dog. So we realize that that's actually where our focus should be, at getting every single county and city in the Wisconsin area to have a dog, because everybody should feel that safeguard of having a dog and an officer together.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank Mega and Dr. Dale Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
There's been a lot of excitement at Haws this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haws know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haws Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haws mission of helping animals in need. Log on to hawspets.org and donate today.
Humane Animal Welfare Society.
And this patient here is Luna.
She's a cute little guinea pig that is not able to stand. She came in yesterday being normal in the morning. Owner got home from work and found her like this. Luna is eating. When you hold her, she'll eat. The owner came in, she's been giving her different vegetables. She really likes lettuce. You can see that her head is twisted or tilted, and it's tilted towards the left side. We think that Luna has an ear infection that is causing this. Dogs will get this. Inner ear infections will often cause the head to tilt and the whole body tilts where the side that the infection is on. And with appropriate medical care, they usually get over it. So we are giving her antibiotics and some time.
You know what an x-ray is? A radiograph? And this is when you take a picture and you see your insides, okay? You can see the abdomen, this is the abdomen, and this up here is chest cavity. So your chest and your abdomen. So this is the dog's spine, like your spine, right? This is the ribs, and this is all the intestines and stomach. Does anybody see what's wrong with this x-ray? Go ahead.
It's all the banking.
Yes, where it pointed out.
Like kind of.
Come on now.
Here.
Yes, good job. Okay, the pink are red blood cells, and the purple ones are white blood cells. Ah, that's why.
Me too.
So what we have to do when we get an animal into surgery, we have to bring them in here, and they go on one of these two tables. We have to give them anesthesia. Here's the anesthesia machine. Okay, so this is gas anesthesia, and oxygen. So what we do is we put them on the table here. We give them IV drugs to put them to sleep. And then we hook the endotracheal tube that goes down their throat. This is for a very big dog. Okay, so this we put down his throat, and then we hook up the oxygen and the isoflurane anesthesia, okay? And they go to sleep, then we turn them over on their back, and we have to shave and shave and shave and scrub and scrub and scrub, and then we wheel them into surgery. Just gave birth. He's got two little babies. He's got two little babies. She. Now it's an it.
Can some of you tall people back up so these short people can get in the front?
Sorry.
So look at where see where the babies, we pulled them out from there?
Stitches.
Stitches. Okay, two little babies. Oh, the babies are at home. She's doesn't like her babies. So we took out her uterus and spayed her because in animals. So you just, this one wasn't. She started attacking them. So we had to feed the babies alone. She's okay. She's really sweet though.
How come guinea pigs don't have like a neck so I don't like scratch?
Scratch?
Yeah.
Oh, they do scratch, but they have a shorter neck. They live in, you know where they live?
Asia?
South America.
South America. Good job. They're around the foothills in Argentina, in Chile.
They eat guinea pigs?
Yes, they do.
What?
They eat these in Argentina and Chile. Yeah, it is what it is. But we take them as pets because everybody loves guinea pigs. It's like one of my favorite pets, actually.
Okay, so this is Speedy. Speedy's here because we had to remove his eye. He came in last week and had a closed eye with blepharospasms, which is just kind of winking. And we sedated him, and upon examination we found that his eyeball or globe had ruptured, which indicates that we have to remove the eye. So we did that, and I actually did that on Friday night. And this morning he's having some post-operative complications. A lot of the times these herbivores can get gastric stasis after surgery just because of this stress. So he's got kind of a low temperature, and we've been having to feed Speedy. So he's in an incubator. We're gonna try to get his temperature up, and just going to show you his eye. This is the eye that was removed. So he's got some stitches in there, and the incision looks pretty good. He's on antibiotics and pain meds after surgery, and he does have a good eye over here, but we don't know if something happened in his cage, if he got some sort of material in his eyes or some sort of substrate in his cage, because the other eye looks like it had been irritated in the past. So we hope he does well, and we're going to just continue with supportive care.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.